And the webinar is titled 5% Continent. And I think the speakers have all talked about the problems of access, especially in rural areas, the strain on public health systems. You know, it's a narrative of lack of resources and broken systems. How much, let me start off with Moses, your own perspectives on, does this narrative hide the historical antecedents of these inequalities and the structural drivers that underpin these inequalities, and your perspective on how we can change that?
Thank you so much. And it's very exciting to hear and learn more about what other colleagues have been going through. I think that many of the challenges that we are facing are indeed historical. And unless we relook at our health system in a way that we've been preaching for a long time, things may not change. You see, the whole aspects or the whole approaches that have been introduced that make us believe that approaching things from a private point of view is the way to go is disempowering our governments as much as possible. And we are bringing a lot of private practice at the upfront, which is continuing to be a problem. We can't do basic things like regulation. You know, I deal with regulation all the time because we think that where the health system is, things will be automatic. I think things can never be automatic. We have moved into PPPs, public-private partnerships, as some of the solutions. And I've always argued that for me, PPPs is not an option for regulation. It is regularizing. And that regularizing is taking us to the historical things that we have always seen, you know, colonial effects, you know, structure adjustment effects, which continuously affect the local person. So usually the local person will feel when the jab is not in their arms, or if they are not receiving what they're supposed to be receiving. But what's the cause of the problem? You know, when you come to the global conversations on access to vaccines that we are talking about, when we come to the injustices that have been caused to our health systems, historically, right from colonial days, why aren't we able to manufacture what we need? Why are we still doing importations of these needed commodities up to 90%? You know, resources have been leaking, resources have been leaving the continent for a very long time. So unless we begin to bridge and have a conversation that is honest, to actually say, this is the time when we need to rebuild these health systems from the lens that decolonize the approaches that we've had. There is no amount of explanation on bad things that we see. I'll give you an example of Uganda. The minister has deliberately refused to actually declare COVID-19 an epidemic. Now, the way the laws were crafted are that if you do not declare the COVID-19 an epidemic, there are steps you can't take. There are steps like how business is done. There are steps like who is responsible for what. So what you're left with is the colonial approach of blaming the citizens and locking them inside, and militaristic approaches. And you see, this is not the way to go, because I think where we have moved, we need to change these frameworks. We need to change the way we work. And we need to stop hiding into PPPs, which at the moment we keep talking about. So for me, indeed, I agree that many of the things are historical, but there should be a point when we begin something. There should be a point when we begin the tough conversations and shift as much as we can. It may not be the big shift that we need, but we need to shift. I think COVID-19 has demonstrated that no matter how much the state runs away from responsibilities, it is the primary duty bearer of these responsibilities. And unless we actually deal with that, things are not going to be the same. So those structural changes have to happen, and we have to look at the history which has led us here. I think the World Bank policies that they have always talked about have failed, tremendously failed in various ways. You know, the results-based financing has been criticized. We have put, you know, you can't apply results-based financing in an emergency situation like COVID-19. So what are those things that we must be doing better than we are doing at the moment?